Our brain is the most complex organ in our human body. A lack of sleep, sickness, or increased stress can impact certain parts of our brain. Delirium is an acute illness characterized by an altered mental state. These symptoms include hallucinations, shouting, feeling disoriented, and loss of memory. The pathway for delirium continues to be investigated. Some studies have hypothesized a molecular pathway that leads to this diagnosis. Fong et al. In a 2011 study show that 20% of 12.5 million patients in the USA brought to the hospital for injury or illness developed delirium. Why might this be? One word: stress. How are stress and delirium related?
The body manages stress through a physiological mechanism known as homeostasis. Homeostasis is the body's ability to maintain an internal balance in response to external perturbations through positive and negative feedback loop. A positive feedback loop exaggerates a perturbation that happens in the body. On the other end, a negative feedback loop works to reduce or counter one, or decrease a stimulus.
Stress is commonly defined by any stimulus that disturbs the body's homeostasis. In humans, the stress response is initiated through the activation of the HPA axis, which is the hypothalamic pituitary adrenal axis. Neurons in the hypothalamus will stimulate the anterior pituitary gland to produce and secrete ACTH into the blood circulation, which induces glucocorticoid hormone synthesis, such as cortisol, to release from adrenal glands. When cortisol is high and the HPA axis is no longer being stimulated, cortisol will block the hormones used to secrete cortisol. When the body is repeatedly exposed to stressors, the stressor is continuously keeping the HPA system activated. The negative feedback loop has now become a dysregulated positive feedback loop through the continuous production of cortisol.
How do these two relate to each other? The HPA axis is activated through neurotransmitters that can be inhibitory or excitatory. The two receptors that bind to cortisol are mineralocorticoid receptors and glucocorticoid receptors. When the body is at homeostasis at low levels of stress, the MRs will have a higher affinity for cortisol than GRs.
During times of stress, the GRs will have a higher affinity for cortisol than the MRs.
While GR are more numerous in number and spread out throughout the brain, the GR are usually inactive. When cortisol is high for a sustained amount of time, cortisol will remain bound to the GRs. These normally inactive receptors are now active and affecting its associated brain structures. The saturation of these receptors cause memory impairment and increased fear response, as seen in delirium patients.
Delirium can affect anyone at any age. However, hospital admissions report the most cases of delirium in patients above 65 years old. As we age, our cognitive level will decrease while we experience an increased onset of immobility, visual and hearing impairments, and social isolation. Fong and colleagues report when elderly patients are in the hospital, these risk factors which cause long periods of stress on elderly patients, posing them at a greater risk for delirium.
For more information on delirium prevention and treatment, visit these websites. If you or your loved ones are experiencing symptoms of delirium, ask a local physician for a diagnosis and advice on treatment methods.